Dental amalgam has been used in dentistry for over 150 years and was grandfathered into use by the Food and Drug Administration. Because of this, the product was not classified. In 1976, Congress passed a law mandating that the FDA classify all products which had been grandfathered into use. After 33 years of ignoring the congressional mandate to classify amalgam fillings, the FDA was sued.
Charlie Brown, National Council Consumers for Dental Choice. Our mission is to ban the use of mercury-based dental fillings, known incorrectly as silver fillings. We sought a court order to order FDA to classify. Judge Ellen Hovell said that's enough. You go into mediation, you come back here a week from Monday, and you tell me what date you're going to classify amalgam. Said that to FDA.
The federal government is again going to look into the safety of the fillings that tens of millions of us already have. The fillings in question are the silver kind, and the concern here is mercury, which is an ingredient. The American Dental Association insists the fillings are safe, but many people believe the mercury can lead to serious health problems.
I, Barack Hussein Obama, do solemnly swear
I will not back down from protecting our kids from mercury poisoning.
While the FDA was working on the classification, newly elected President Obama had nominated Dr. Margaret Hamburg to be commissioner of the FDA.
It is a privilege to be here today to discuss my nomination as commissioner of the Food and Drug Administration. To me, this means operating an agency that is accessible and transparent. The FDA has responsibility to ensure that its work is driven by the best possible science and is undertaken with integrity, openness, and credibility. I'm happy to answer any questions that you may have.
Senator Enzi is...
During her confirmation hearing, she was asked of her position on dental amalgam.
She's asked about the rule in the Senate confirmation. She should have said I'm recused from that rule. Instead, she didn't.
Dr. Hamburg failed to disclose to Senator Enzi that she was a board member of Henry Schein, the largest distributor of amalgam in the U.S. After her appointment was confirmed, Dr. Hamburg inherited the oversight of the amalgam rule already in progress at the FDA.
Hamburg had a conflict that should have resulted in her dismissal as commissioner. They made her sign an ethics contract that said, I will not participate in any matter affecting Henry Schein as long as I own the stock or stock options. So she checked the price of her stock options a day before the meeting that she knew was being held. July 1, she had the meeting to discuss the amalgam rule with Susan Runner and other top FDA staff. She went ahead and worked on the Henry Schein rule while she owned the stock options. In mid-July, she said, okay, I'll recuse myself for ethical reasons. She will not disclose how she recused herself, when she recused herself, whether she recused herself. We take their word for it. You understand a recusal is normally a written phenomenon. The judge says, I'm off this case. The commissioner says, I'm off this case. She never wrote down anything. Hamburg, in the final weeks before the rule, wrote Henry Schein's lawyer and said, I want to unrecuse myself. Will you take back the stock options? I want to get back in and regulate for you. I want to regulate for you. I want to end my recusal of anything affecting you so I can go back, take my stock options back. And the guy was happy to do it.
A recent study by the Food and Drug Administration found no valid evidence that amalgams are unsafe. That's great news for patients and dentists alike.
The International Academy of Oral Medicine and Toxicology, a scientific organization made up of dental, medical, and research professionals, immediately started combing through the new rule and found many glaring errors, all in favor of the safety of amalgam.
The petition for reconsideration challenged the FDA final rule on regulatory grounds and scientific grounds. We found 27 propositions of error, and I mean big errors, in the FDA's final rule. The public doesn't know it because the public doesn't keep up with this, but the FDA knows it. Amalgam somehow gets a free pass. I don't understand it, and I can only assume that it's political influence brought by the ADA that's causing these aberrant results.
Not everyone agrees with the new Food and Drug Administration report that's out this week. It says silver dental fillings are safe. In fact,
the final rule of the classification was a huge disappointment to health advocates, as it declared the mercury vapor released from amalgam fillings to be safe for anyone and everyone. With the news that there would be no constraints upon the product, Henry Schein's stock soared.
Hamburg writes him the day the rule comes out and says, my friendships with Henry Schein outlasts my recusal. My friendships outlast my recusals. Schein stock jumps $1.50. July 30th, the General Counsel writes Margaret Hamburg, we are indebted to you for your work as commissioner. We are indebted to you.
That's the kind of thing that happens in Washington that creates in everybody's mind that we're all corrupt up here. Well, I'm Congressman Dan Burton from the 5th District of Indiana. And when you find out that government officials who are making decisions regarding the health of the nation are doing questionable things, it only adds to the problem. People should have confidence in the government that we're trying to do the best we can for them. And if the head of the FDA has stock in a company that makes dental amalgams and they're making rulings, they should be recusing themselves. And if they don't, I think that they're guilty of criminal activity. And the reason I say that is because I am convinced, after having been the chairman of government reform and oversight for 6 years and had numerous hearings on the subject, that the mercury in the amalgams does cause human neurological problems.
She should not be FDA commissioner, absolutely not.
Healthcare professionals and folks all over the country are asking the Food and Drug Administration to protect and inform the public about the potential dangers of silver amalgam fillings. Those include my colleague Stacey Case. Now, we've been following Stacey's personal story for months now, telling you about her diagnosis with multiple sclerosis after a routine dental procedure. And tonight, Stacey is in San Francisco, sharing her story with the federal government.
Nearly 4 years ago, I let a dentist talk me into having 4 30-year-old silver mercury fillings replaced because he said they were cracked. Your agency at the time, though, the FDA, had done nothing to warn me, an educated professional, that this was a health hazard. This is a great injustice. 7 months after that dental work, I got out of bed one morning and could not walk. My children were 2 and 3 at the time. My immediate concern was, will I be caring for them or will it be the other way around? I now know that I and millions of other Americans are genetically predisposed to autoimmune disease, and these mercury fillings are the trigger in many cases. I've read several dozen scientific studies. One such study, 1990, University of Denmark, proved monkeys with mercury dental fillings stored it in their spinal ganglia, pituitary gland, and many other organs. This stuff seeps into the body from the day it is implanted. Then one day you reach the tipping point like I did, and disease sets in. Your hand-picked scientists in 2006 and 2010 have made you keenly aware of the health risks and the disease causation. Please do not ignore them or injured consumers like me any longer. You really want to help this country get healthcare costs under control? Ban amalgam. You really want to see a cure for many autoimmune diseases? Ban amalgam. You really want to ensure American moms like me can play chase with their children in the yard? Ban amalgam. After 2 decades in the news business, I know the truth, and the truth is silver mercury fillings are causing disease, and they are making people sick, keeping them sick, so help me God. Use your power and position for good, Dr. Shuren. Leave a legacy. Please right this wrong.
We've gone back and we looked at the evidence, and what I can tell you is we intend to come out with an announcement by the end of this year.
Since that missed deadline, the FDA has been silent on where the ruling stands.
Obviously, this has been an emotional journey, but an important one, and I just hope that my story affects change. In San Francisco, Stacey Case. Scott, back to you.
We've gone back and we looked at the evidence, and what I can tell you is we intend to come out with an announcement by the end of this year.
And so 2011 came and went, and sometime early in 2012, I sent an email to my contact at FDA. The response I got was, we'd love to respond. We sent our document to HHS for approval, and unfortunately we don't have a response back yet. We sued FDA to compel them to respond to our petitions after waiting very patiently for 5-6 years. And they did so. In January of 2015, they came out with a document that completely affirmed what FDA had found in 2009, which was that mercury fillings are completely safe. We, my team, IAOMT, we were all deeply disappointed. And then we get this whistleblower document. It was a document that provided prohibitions on placing mercury fillings in tens of millions of people. What happened here? What happened? HHS came back and provided a political solution to a thorny scientific problem. HHS put the veto on this statement of policy that would have been published by FDA, but for HHS's political decision, not scientific, political decision, to not change the way the game was played. But don't be deceived, there are hundreds of peer-reviewed, published scientific studies by top authors that associate the mercury in fillings with systemic disease. And so, going forward, what are we going to do? We're going to go back to court and take this document that was issued way back in 2012 that states what FDA really thought about all this and ask the court to reinstate the 2012 document. That's our plan.